Go ahead and introduce myself again. So my name is Gary Herbst and I'm the Chief Executive Officer here at Kaweah Delta Healthcare District. I'm joined by Dr. Dan Boken, Epidemiologist and the Medical Director of our Infection Prevention Program. We greatly appreciate all of our partners here this morning virtually. I think this is probably the first virtual press conference we've ever done with our local media. But we consider you to be an incredibly valued partner with us right now as we jointly work to battle this unprecedented coronavirus that has taken hold in our county. I will be very open to answering any questions you have. A few things that I'll probably brief you on initially. Number one is I cannot underscore enough how serious this virus is and how quickly it is spreading. I literally have already been on probably 4 calls this morning getting updates on how rapidly it is spreading throughout Tulare County. While we're fortunate that we've only had a few inpatients that have actually tested positive, we expect that to increase significantly as the month carries out. If you look at some of the predictive modeling tools that are out there today, and what's fortunate about it is there has been, I wouldn't say it's been a slowdown, but there's been thoughts that the social distancing, the hand washing, the discipline of not touching our face, everything that we're doing as a society to slow the growth is making an impact. So initially they were thinking that this weekend that the Bay Area was really going to start feeling the brunt of the surge. The models have now pushed that off a couple weeks, and we believe just because of the lower population density that we have here in the Central Valley and here in Tulare County in particular, that we're probably a week to 2 weeks behind some of the more densely populated areas. So in all likelihood, we will really start feeling the brunt of the surge towards the end of the month. So we are taking a lot of steps to prepare for that. Fortunately, we practice natural disasters all the time. Throughout the year, we run what we call mock disasters, and we try to create all different types of scenarios that might hit us. And we just recently, this last year, had performed an exercise in the event that we were undergoing a flu epidemic or pandemic. So what was practice just not too many months ago, obviously we find ourselves real life dealing with that right now. And so I think I'll just share with a few things that we've done, again, just preparing for the surge. We actually have created a dedicated inpatient unit in the hospital. It's in the Mineral King wing of the hospital. It's on a unit we call 2 South, which is a 29-bed unit. That unit has normally been used for observation patients, so just monitoring patients, not certain if we were going to admit them or not. A lot of times they end up simply being discharged from that unit without ever being admitted. So that now is a dedicated COVID unit. So patients that have tested positive for COVID or are suspected of having COVID, or we want to rule them out, or they have a respiratory condition, we are kind of cohorting them where we've got the right personal protective equipment. We have staff that are trained in managing those contagious diseases and respiratory conditions. Today we just converted an 11-bed unit we call the Broderick Pavilion on the east side of the hospital. That historically had been used for elective surgeries, generally somebody having a knee replacement, shoulder surgery, otherwise healthy, 2 to 3 day stay. That's now been converted to also potentially a dedicated COVID unit. That's an 11-bed unit. Next week, we will complete one of the expansion phases of the emergency department on the north end of the ED, an area that we call Zone 4. It has 9 beds. That area could be dedicated to also taking care of COVID patients. Not initially thinking that would be an inpatient unit, but it would be an area available for the emergency department to cohort potential patients in that area. You probably know that we've been working on infilling the 5th and 6th floors of the Kaweah wing. We've actually been working on that for over a year now. The 5th floor to be a 24-bed intermediate critical care unit, the 6th floor to be a 23-bed neonatal intensive care unit. We were probably 2 months away from completing those, but the state is literally suspended, all rules and regulations that would normally be how we'd still have to work through OSHPA and work through the California Department of Public Health and licensing and surveying. Well, that's all been kind of thrown out the window, and just getting tremendous support now from those agencies, allowing us to greatly accelerate activities we're doing. So we literally will open the 5th and 6th floors next week. The 5th floor is a 24-bed, again, intermediate critical care unit that could be used to take care of COVID patients, patients with respiratory conditions. The 23-bed NICU, we will use it for neonates, but we will be moving the patients that are in our 15-bed unit right now, which is on the 2nd floor of the East Tower. We're going to move those into that 6th floor, which will open up that unit probably for 9 more beds that could be used for adult patients. We also, our pediatric unit, it's a 12-bed unit. If needed, we'll move those patients onto mother-baby, freeing up those 12 beds for adult. And if this was to get really bad, if we really found ourselves under siege, I've already spoken to the CEO of Valley Children's Hospital, Todd Suntrapak. Fortunately, children have seemed to be, have been less impacted by the virus. Valley Children's has quite a bit of capacity right now, and they are willing and ready to take all of our neonates, all of our pediatric patients. If need be, we would transfer them up to Valley Children's. Again, that would then free up the 6th floor of the NICU and potentially those mother-baby beds that we'd put PEDS patients in, so that could create additional capacity. So that's kind of what we're looking within the confines of the Kaweah Delta facilities, which we have full discretion to act as quickly as we need to and as best as we think we need to. We don't need to get permission from anybody at the state or federal level. But if it was to expand beyond that, if we had to go outside of the walls of Kaweah Delta, you've heard probably me talk about potentially the convention center. Greatly appreciate the support of the City Council, Mayor Bob Link, City Manager Randy Groom. Randy and I, he was probably one of the first people that reached out to me when this virus started breaking out and said, Gary, the city is ready here to support you in any way we can. If you need to take over the convention center, you're going to be at the top of our list, and obviously so many events have been canceled now. It's quite available at this moment. We also, with the city's blessing and support, we just closed Floral Street between Main Street and Kaweah and have moved our specimen collection process out into that Floral Street area, which allowed us to open up 9 parking spaces where cars come in, driving into South on Floral, and they park. And we go right out to their cars and we swab them right there. They don't have to get out of the cars and collect the specimen and then send it off to the lab for testing, send the patients home, and then follow up with them to let them know what the results of that test are. Obviously, we continue, interesting, and it's a little eerie right now, and that's why you hear me say the calm before the storm, or I hear often that, back in the Midwest where they experience tornadoes, that it gets eerily still right before a tornado hits, and perhaps that's what we're feeling right now. Our hospital has more bed capacity than I think I've seen in the last 10 years. We're running just slightly above 50% occupancy, but that's been purposeful. That's not, people are definitely staying away from the hospital if they can. If they truly don't have an emergent condition, people are putting off, getting their knee replaced or their shoulder surgery done. They're putting off screening, colonoscopies. If I needed a CT or an MRI of my hip or that's been bothering me, patients have been essentially canceling those, which we appreciate, taking pressure off the hospital. But we also, a few weeks ago, really started curtailing non-emergent, non-essential elective surgeries. So both inpatient and outpatient. So that has had an impact as well in terms of freeing up those beds. So I'd like to say that we're in pretty good shape right now to absorb the volume of patients that are coming to us. We have been able to take care of them. We have 104 ventilators that we own. 9 of them are pediatric ventilators, and about half of them are currently in use, which means we have about 50 that are in stock right now. But again, if we find ourselves under siege, we will go through those very, very quickly. But if what we're experiencing today, God willing that this is, that it wouldn't escalate much above this, that we'd be in pretty good shape. But we're not fooling ourselves. We fully expect that it's going to continue to escalate. We just see the transmission rate, how quickly it can spread. Just this week, I think you heard that we had a breakout at a skilled nursing facility just because of the confinement of patients there. It can spread very rapidly. It started out just 6 patients, and I read this morning now it's 9 patients. So you just see how quickly this virus can spread. So I guess in just my closing remarks, I would again like to thank our partners in the media, all the coverage you've given us. The Times Delta, thank you for the great coverage, the daily joint newsletter that we're sending out. I cannot overemphasize the social distancing, the value of that. Washing your hands, not touching your face. So much of what happens to us is absolutely in our control. And so it's not just what happens over the next 30 days, it's what happens next week, it's your actions this weekend. Again, today's Friday, wash your hands a lot, discipline yourself, don't touch your face, and practice that good social distancing. So I'll leave it there. I don't know if Dr. Boken wants to offer just some general remarks. I know we want to answer all your questions. Dr. Boken?
I don't think I have a lot to add, Gary. We were prepared. We both attended a very engaged MEC meeting last night where the medical staff leaders were really asking very appropriate questions, appropriately concerned. There's nobody that's expecting this to be a non-issue for us. It's really just how much readiness can we do. There's a lot of irons in the fire, so to speak, people looking at all sorts of avenues of readiness. That's from the ventilator issue that Gary mentioned to staffing and other questions. Those are all being looked into by the team, including some members of the medical staff. So we expect to be ready. Again, thankfully, we're not facing that surge at the moment, but we are still seeing cases in the community, so do be careful. So doing your thing at home is more difficult than it seems. I too am a parent and have children at home, and so it is harder for others. Our children are a little bit older, so we don't have to worry about them as much. But those with young children, it's a more significant challenge. So we wish you luck. We know it's difficult. Do your best. Hopefully this will be as short as possible.
Great. Thank you, Dr. Boken. I think now we just like to open up to questions.
Okay, they are all unmuted. Okay, we're ready for questions.
Hi, this is Dennis from KC24 and CBS 47. Thanks for your availability today. Just had a quick question. How many beds do you guys have available right now? I know you said that occupancy is about 50%, but just how many do you guys have?
So at the General Acute Medical Center located in downtown Visalia, we are currently licensed for 403 beds. That includes 21 beds in our medical ICU, 20 beds in our cardiac ICU. We have a 24-bed cardiac intermediate critical care unit that's all telemetry monitored. We have a 30-bed intermediate critical care unit on our West Campus. But those 403 beds also includes mother-baby, pediatrics, those other areas. But again, as I mentioned earlier, plans are already in place where those beds could be converted to adult beds as well. Next week, we'll open up the 24-bed 5th floor and the 23-bed 6th floor, so that will add, an additional 47 beds to the 403, so that'll take us up to 450 beds in the acute medical center. The census, I think, as at today, was about 228 of those 403 beds. Obviously, patients continue, unfortunately, to have heart attacks and strokes and emergency surgery and trauma, cancer treatment, things of that nature. So those patients continue to come to us, and we continue to provide that care. And so most of those 228 patients that we're taking care of are patients that are here for that purpose. As I think I mentioned earlier, only 5 of the patients that we have in-house today are actually here because they have the COVID virus, and we are taking care of them. So the vast majority of patients and the beds that they occupy are completely unrelated to COVID.
Hi, this is Caitlin Washburn with the Sun-Gazette. Thank you for doing this. How many in total have you tested, and how many tests do you currently have at the hospital?
So great question. I happen to be armed with that information, although it's not the most current. Every single day, Kathy Whitman, who is our infection prevention manager, about this time every day, she sends out a daily dashboard that shows us up to date what the activity has been. So up until just recently, Kaweah Delta does not actually do any of the testing. The testing to determine whether somebody is positive or negative for the virus has, for the most part, all been done by the county public health department at their laboratory in Tulare. So that's where we do send the majority of our specimens for testing. Although there are also a couple commercial labs, Quest and LabCorp, that are offering testing capability as well. So we're a specimen collection site, and that's what I was describing over on Floral. So as of yesterday at 9 a.m., we have collected a total of 895 specimens. 48 of those tested positive. The vast majority of them tested negative, but there's still several dozen that are still awaiting the results of that. We're generally testing anywhere from 40 to 70, collecting specimens on 40 to 70 patients per day. And on average, about 5 to 7 of them are testing positive. We're generally getting the results back from the county within about 24 hours. And I just want to commend Dr. Karen Hott, Jason Britt, Karen Elliott, Tim Lutz of the county, doing a phenomenal job supporting us, and we greatly appreciate their efforts. You might be interested in knowing the age distribution of those patients that have tested positive. Interestingly, the majority of them are in the age category of 20 to 29, which is not necessarily what we are expecting. Unfortunately, I'm concerned that age category is not being as vigilant as they could be in terms of social distancing and exercising, the hand hygiene and staying away from your face. Unfortunately, I do hear in the community that young people are still getting together socially for pretty large events. So of the 48 that tested positive, 18 of them were 20 to 29 years old, 7 were 30 to 39. We only had 3 that were in the 0 to 19 category, 5 that were in the 40 to 49, 4 that were in the 50 to 59, 4 that were 60 to 69, 6 that were 70 to 79, and 1 person that was in the 80 to 89 category. Interestingly, of the 48 that have tested positive, only 11 of them are 60 years or older. So the positive testing appears to be in a younger population, but absolutely that older population who tend to have a higher prevalence of underlying health conditions. Congestive heart failure, COPD, diabetes, hypertension, things of that nature definitely makes them more vulnerable to the disease and more susceptible to the more severe reactions to it. So while you may be young and feel confident in your ability to fight the disease should you contract it, which I don't dispute that you're going to probably do a better job, just be very mindful that while your symptoms might be very mild, that you can actually infect older people that don't have the same, immune strength that you do. So next question.
Hi, this is Kyra with the Times Delta. I was wondering, you mentioned the number of ventilators that the hospital has, and I was wondering if the current amount that you guys have, you're anticipating that would be enough for the upcoming anticipated surge, and then if not, kind of what the plan is in terms of, acquiring more, or kind of what you would do if you run out.
Right, great question, and one that probably causes us the great amount of angst. Of the 5 patients that are inpatients right now, 4 of them, it could be 5 by now, but as of last night, 4 of them were in the ICU and were intubated and on a ventilator. So unfortunately, everything we read and hear, what we're witnessing in New York and the more populated areas of California is as the disease really exacerbates in an individual, the greatest difficulty they have is breathing. And so that's why they end up being intubated. I am very concerned that we don't have enough ventilators. We are trying to get more, but today they simply are not available and certainly not available to us in a smaller community. So generally those larger communities that are being hit more severely right now are where most of the ventilator supplies are going to. I do fear that we'll quickly run out. And unfortunately, that was part of the sobering discussion that we had last night that Dr. Boken was referencing. We had an emergency meeting of our medical executive committee to talk about that very issue, is, how would we triage patients? How would we determine who gets that ventilator and who doesn't? Many hospitals are already developing triage algorithms that will help them in that decision-making process. You've seen that implemented in New York, and I don't want to scare people. Again, I applaud the efforts that Tulare County residents have taken to, really try to buffer this virus, but that is a reality that I hope we don't ever, have to deal with. But you have to plan for the worst and hope for the best. So we will continue to try to procure ventilators as they become available. Other questions?
This is Caitlin again. Has the state been in touch with you about getting more ventilators? I know that they've been trying to get more, and there have been issues with some not working great and having to rehab them. But do you know if any of those reserves will be coming your way?
I don't think any of us are having direct dialogue with the state, although we do We do have dialogue with the California Department of Public Health, but we're not having direct dialogue with the governor or his COVID-19 committee. Generally what happens is the federal government works with the state governments who work with the individual counties and the Department of Public Health. So we are in constant communication with the local Department of Public Health, and they have been our primary supplier of personal protective equipment. So every day we're placing orders to the county for N95 masks, for surgical masks, gloves, gowns, other PPE, and those shipments are coming to us from the county, who in all likelihood is getting theirs from the state, either out of state reserves or out of the federal national stockpile that is flowing to the state. So I do every couple days, I participate in a call with all the hospital CEOs stretching from Kern County to Merced County. We're all working together to try to develop kind of a coordinated, more regional San Joaquin Valley response to this. Sharing of ideas, potentially sharing of PPE. And I think that's the way the state's looking at it as well, is that this will require a statewide response. So right now, again, the heavily populated areas like Los Angeles and the Bay Area are being the most impacted, so that's where the resources are going. But as it spreads and potentially as these densely populated communities become overwhelmed, they in all likelihood will be reaching out to other parts of the state where there might be other bed capacity or even ventilator capacity to kind of spread the care and treatment of this population. So short answer is we're really not in any direct dialogue from the state, and our supplies are not coming from them. They may be indirectly, but we're really working with the county and just normal vendors and suppliers that we work with. But again, where we would normally buy ventilators, we've absolutely reached out to those vendors and placed orders with them, but as of today, none of them have been filled. Next question.
Okay, Gary, so this is Laura Flores McCusker again. You know, a lot of people have been sheltered in place for almost 2 weeks now, right? And a lot of people want to get back to their normal routine. So what is your message to them today?
Yeah, I would just echo Dr. Boken's comments earlier. It is incredibly difficult. I guess Dr. Boken and I and the other folks in this room were fortunate that as healthcare workers, I know I greatly appreciate the outpouring of support and encouragement and all the things that people have been donating to the hospital and just the words of encouragement. We greatly appreciate those. But we get to come to work every day and interact with our colleagues, our peers, other human beings. We get to come to work every day and take care of patients, and you know, we feel very connected to this crisis. I think it's actually more difficult for people that are staying home, that are having to isolate themselves. I know you really, again, gratefully we appreciate how you're feeling about us, but I similarly feel for you as well. I look at my wife who's home alone. Our kids, you know, have moved away to different parts of the state, and we miss them, you know, immensely. So I would just, you know, try to stay positive. I know the media probably won't appreciate this, but don't watch the news 24 hours a day. It's depressing, frankly. So, you know, try to exercise, you know, try to stay active, try to stay positive, connect through Facebook, call people. You know, take that quiet time that maybe we don't do when we're so busy living our lives, and you know, learn a new hobby. My wife and I are practicing our cooking skills. I don't know if I said this earlier, my wife cut my hair on Sunday. I was scared. I was sitting in the garage on a stool and put one of those big leaf bags around my arms and head, stuck them out, and then she took a pair of scissors, but she did a pretty good job. So she's learning a new skill too. So, and my advice again, social distancing, washing your hand, not touching your face. That should be your daily mantra.